Welcome to the Kier Beyond the Bill podcast, where we get together with Kier and industry experts to explore the big issues affecting our sector. In today's episode, we're talking about Kier's recently completed project at the Devizes Integrated Care Centre. So Devizes has been described as a healthcare facility for the 21st century and is a great example of both what can be achieved with early contractor engagement, but also the positive impacts of a locally driven healthcare project, which has been designed and delivered with patient and staff experience at its heart. We kicked off today's conversation with Andy Strange, Midlands Regional Partnership Director for NHS Property Services, and Cheryl Parsons, Health Sector Director for Kier. I started by asking Andy what an integrated care centre is.
The real key important point about Devizes was how we developed a new facility that facilitated a whole range of different services working together. So a number of the services are in individual buildings on the existing Devizes Community Hospital site. There are primary care services that are provided from GP surgeries separately. And what this building does is really helps to enable a variety of different community and primary care services to come together under one roof and actually work really closely together. And the whole ethos of the project and the design and layout of the building really kind of stems from that starting point. So, the early discussions we had, particularly with Richard Sanford-Hill, the GP, and Wiltshire Health and Care's representatives, were really around how we do bring services together to work more closely together. So the building really is trying to facilitate that much closer joined up working, so that for patients like you and I, if we have a problem, we've got one front door to go into to get a variety of different treatments or areas of support.
So the centre's only been open since January, I believe. Is it too soon? Is it too soon to understand the impact on patients and staff, or are you starting to get some good early feedback already?
Well, I think we'll want to keep reviewing how the building's working over a period of time and compare it to some of the other buildings in our portfolio and see how as a building it performs. But certainly we've already had positive feedback from staff who obviously now, some of them were working in what was an old cottage hospital in fairly poor accommodation. We've now got great, fantastic consulting spaces, a lovely bright and airy waiting area, a single reception point for people to come into when they're coming to visit the building, and the reception staff themselves, saying, this is great, this new facility. We in property services, we do our own patient surveys. So in due course, we will do surveys of Devizes to understand how patients feel about the facility. But I think generally the feedback from patients to the clinicians and reception staff so far has been really good. And I think it's been a long time coming, but people are really pleased to see investment in the NHS and Devizes and the quality of the new facility that's actually been delivered there, which is fantastic.
Cheryl, I've heard you speak before about you going down to look at the project when it was literally just a field. So obviously this is a brilliant example of what we often refer to in the industry as early contractor involvement. Can you talk to us a little bit more about that in terms of what that means and what the benefits of it are?
Yeah, of course. So as you say, I remember going down, I think it was a lovely sunny June day, and looking at a field that really was a green field, and looking around at the infrastructure and thinking, talking about what might be built there. So I think when you're engaged right at that early outset, I think the first thing that's really helpful is to really understand the vision and the purpose of what's being built. So, being able to engage early, you really can help to plan from the outset. You understand the drivers, you understand what's really important to our clients. And, we had the launch workshop, was so well attended by so many different stakeholders. And I think often when you're engaged at a late stage, we only have a certain ability to influence at that stage. When you're engaged at the outset, you really can add value from the beginning. And so a good example is where, to understand those drivers, it wasn't just about how the building was going to be used, it was how it was going to be operated going forward. So, we were looking at the fabric first approach. So we were looking at, how can we find the right materials that are then energy efficient and that can, lead to the lower costs of running going forward. So to understand all that from the outset really helps us to build that in, so it's not additional costs that we're adding later on in the stage. You know, we're thinking right from the outset about how it can perform in use and what outcomes are, rather than just you know, was it built to time, budget, cost. You just start looking much more holistically about the overall drivers.
Yeah, so it's true value for money, really, then, isn't it, building that in?
You've just reminded me of the early workshop actually that we had, that you came down to. I think it was in the Corn Exchange in Devizes, wasn't it? And we did have a great number of stakeholders there, and that enabled us to kind of really work with Cheryl and the team to, you know, look at how the services would work together. So we didn't want lots of separate sub-waiting areas and separate reception areas. We wanted a real building where, you know, as a patient you come in, it's one building, you don't get the feel there's lots of different NHS organisations operating from the same facility. I think there's a whole load of other stuff we talked about. You know, we were fairly early on, we had to make decisions about thinking about the BREEAM requirements and minimising the external envelope of the building to minimise heat loss and how that might impact on the layout. So a whole load of stuff came out of that early engagement, I think. And Cheryl and the team were able to really help input into that process. So
yeah, no, absolutely. And it was, so as you say, you know, it was a great example of that stakeholder meeting where you start to really get the engagement of all of those stakeholders who, you know, they're not used to the building process, they're used to delivering care. So you're able to, right from the outset, kind of take them through that journey to say, you know, this is the process that we're going to go through. You know, this is the decisions that we need to make on those points, and this is what it's going to mean. So you almost get that real buy-in right from the outset, and having us involved right from the outset, we can really help to explain and expand that journey. That means that when you come to operating that building or using that building, you feel like you've been part of developing something that's right for you at the end. And I think we looked at critical success factors. So what's really driving this project from everybody's point of view, and actually what compromises might we need to make, or how does things like the budget impact the programme? And you really bring people on that journey, but make sure that the whole team, including our team and supply chain and design team, all buy into what's important for the outcomes, rather than just what is the process we get to. It's all on the end goal, if you like, rather than the journey.
I think it's good to bring people together as well, wouldn't it? To actually get them motivated to feel, by bringing you on board, it helped us, I think, demonstrate that we've got a real project here. We've brought a contractor on board early to get people engaged and think this is really going to happen.
Yeah, absolutely. And I think it's such a great example of collaboration. When we talk about collaboration, having everybody there. So when you look at early contractor engagement from the outset, if you're all in the room with that shared vision and purpose, then everybody's pulling in the same direction. You buy into that vision, and you can really look for solutions that puts the project at the heart of what we're doing, rather than people working in individual silos or just being responsible for their task.
Yeah, and can you give us some examples then, Cheryl, of things that we introduced, or elements of the building or elements of the design that having that early contractor engagement led to?
Yeah, absolutely. And so one of the key things was really thinking about the lessons learned that we could build in for the building fabric. So we've recently undertaken a passive house scheme, our leisure centre, and we were able to bring some of those principles really early into the decisions we were making around the building. So actually Devizes is net zero carbon in operation. And that wasn't an initial requirement or factor, but it was something that we were able to draw lessons on that we could really build in. So, we would design with that in mind. So whether it's from detailing, looking at natural ventilation, we added some solar panels PV, which enabled us to really achieve net zero in operation. And we did that because it was the right thing to do, and it's how best can we make this an efficient building to operate. It wasn't a huge cost added later on. It was something that was developed right from the outset.
That's fantastic, isn't it? And Andy, are you seeing that's having an impact in terms of running costs and so on, having the fact that we've delivered essentially a healthier building, as it were?
I think through the early workshop design work with Cheryl and the team, we elected to go all electric with the building, which was an important decision to make. We elected to go for natural ventilation rather than an active ventilation system. So those kind of key decisions helped inform the building. And in property services, we've got our own green plan in common with many other NHS organisations. I think we saved about 30% of our carbon footprint since the baseline in 2018, and we're looking to build on that going forward. So really crucial that we looked at how we could develop a building that minimised energy use going forward. And there have been lots of detailed discussions about window designs and types and how people can, have shades on them, and how they can actually, the clinicians I think were quite keen that they had a window that was openable. So, whole load of small design details that we looked at through the process. But also from the very outset, I think with your team, we were advised to look at a building that was kind of rectangular in shape and that had a kind of north-south orientation to maximise opportunities for the energy efficient design. So a whole load of elements that went into the building. I hope when the users get their first utility bills, we'll find a good outcome. So certainly early signs are very good. So.
And that's the beauty of being able to go and look at you don't always have the luxury of a greenfield site, but right from the outset to be able just to test and challenge some of those assumptions about building orientation that can have such a massive impact on how that building's going to perform. Being able to be engaged early really allows us to add that value from the outset.
And so working in the construction industry, we often talk about net zero carbon, passive house and so on, and we understand those real drivers in terms of delivering these types of buildings strategically. Andy, does the community, what does the community think about the fact that they've got this net zero carbon in operation building? Does that register at that really local level in the community, or is it more about the services which the new facility is providing?
When you go into a building, if I go into any building, I'm not necessarily aware of how it's heated and what the energy consumption is. But I think, the direct impact of reducing the cost of energy and the cost of running the building enables that money to be instead invested in better patient care and more services. So I think whilst, people can't see the solar panels on the roof, they can't see how thick the walls are and the insulation, they can't see the passive ventilation system that's in operation. I think it's the indirect impacts of being able to save costs on energy and also hopefully having a comfortable building for A, clinicians to work in, and B, patients to come and visit will also be significant.
I mean, we've spoken about the environmental benefits that the new centre is providing, but we often talk about social value or social sustainability as something which is really important as well. And Cheryl, I saw that I think 35% of the supply chain labour was procured from within a 40-mile radius. How difficult was it to sort of source and get that supply chain in place? Again, was that the habit was being involved early? Did it facilitate that?
Yeah, absolutely. And I think, as you say, we aim for as much local spend as we can, because I think as we know, especially when it comes to healthcare, having those additional jobs, being able to put the money back into the local community, it's not just about the benefits to the project, it's the legacy that you can leave as well. So, the more that we can support our local supply chain and, can give those opportunities. I think one of the great things when you can use local supply chain is it's often their hospital, or it's often their facility, or it's often their, in this case, their treatment centre that they will access, or their families will access.
Have you had interest from other areas? This is obviously a very locally driven project, but have you had other sort of NHS PS regions coming to visit? Is this being used as an example for other areas?
Yeah, I mean we're looking. We've been developing a number of other facilities across the area. We've got a new facility down in Hythe that we developed, but we're also we facilitate a visit by a number of GPs from Surrey who are looking at a new facility over there. and I think they were really keen to see what this new facility looks like, and I think they were really impressed by the quality of the accommodation available, about the approach of having that single reception and coming in, rather than having lots of different reception areas. So I'm hoping that there'll be some really good lessons learned from this. So we the building's got some technology in it. The doors are on electronic operations, so we can actually see how often the rooms are used from the data we gather. That will help inform the providers who operate there and the commissioners who commission the services to actually think, are we using this building in the best way? Are there any areas or rooms that we're not using as well as we might? Could we deliver other services from these spaces? So I think, we all know that building technology is evolving quickly, and with sensor technology as well. Hopefully we'll get some good intelligence back from this building, not just in terms of energy use, but actually wider utilisation of the building, to understand how we can continue to use it flexibly, and how we might use it as a model for other schemes elsewhere.
And I think, and you're right, again, whether it's that early contractor engagement or just understanding that purpose, it means that we can really look at designing that space so that it can be used, as you say. So it's giving kind of that longevity of space, but also sometimes technology and things change really quickly, or the needs change. So it also enables us to go and fit out and look at other solutions should they be needed. So that building's got a real purpose for a long time.
So it's great. So as you say, Andy, you describe the building as being maybe quite a modest building in itself, but certainly in terms of the way that we've designed the building, that we're using the building, the way that we're using technology, actually, there's some real ambition there.
Yeah, and I really hope that what we're intending to do. We've got a number of other relatively modern health centres within our portfolio. I think we've got about 1,200 in total across England, and we can actually look at, from an energy performance or all sorts of other approaches, how this building's performing compared to some of our older stock, and actually, hopefully, by looking at how we benchmark this building against others, it can really drive improvement going forward.
See, that's exciting, isn't it? Using data from the building to sort of influence strategy and so on, and take really drive those lessons learned.
Yeah, helps build the business case for future investment as well. If we can see that there's a real return on investment by investing in a building, having better performance, lower energy bills, that all helps build the case for change and for ongoing investment within the NHS estate.
That's, it feels something that we as Kier are committed to as well, in terms of, going in and undertaking those post-occupancy evaluations and kind of really understanding that, and then able to take that data into all sorts of spaces.
Yeah, so there's a real benefits for the Kier team then, Cheryl, in terms of how we go forwards and work with other clients and to deliver these projects.
Absolutely, and you take it, we mentioned just using some of that, the process of passive house into these buildings, but then we can then take this process into other sectors as well, and really share some of that learning, not just across our health portfolio, but with so many people benefit from what can be quite straightforward and quite simple decisions that you can make, and then, as you say, underpinned by that data, it just makes such a difference and adds so much value by bringing that from the outset.
Yeah, I love that. So this idea that we've got this building in this local community that's having such fantastic benefits for patients and for staff and for the wider community in terms of the economy, but also then I guess at this more macro level is the potential impacts in terms of data, strategy, business case for new buildings, but also developing those skills and that knowledge within the construction industry as well. It's just a really fantastic case on so many levels.
Yeah, and I think we're really invested in understanding how this building will perform to other buildings going forward. Often things happen, new buildings come along, people move on, and that's the end of the story. But actually, really understanding how this building is going to help improve service delivery, measuring whether it delivers the benefits that were identified in the business case. I think that's something we're really, certainly in property service, going to really keep hold of. And I'm sure I'll keep in touch with Cheryl about those kind of things, really, to, because it's really important to learn those lessons going forward, to get your product better every time. So that kind of continuous improvement pathway is something, we're all really focused on as well.
Cheryl, you spoke about us using our passive house knowledge that we developed on projects such as St Sidwell's Point down in Exeter. But did we have any other experience of delivering projects locally that we were able to use that local experience and knowledge to deliver Devizes?
A lot of our health team have been working in healthcare for 15 years. So, really understanding how to ask the right questions. So whether we're doing works at RUH Bath, which actually was one of the stakeholders, Musgrove Park, we've got, a number of projects which, albeit aren't necessarily the same primary care facilities or the same community care specifically. It's all about, understanding the environment that you're working in, understanding the end users' requirements, and clinicians' time is so important as well. So being able to really understand how you gather and understand the brief, then develop a solution that can be easily signed off with people who are, so pressed for time, making sure that information's delivered in a really easy to understand format. That means people can make decisions and get that buy-in. I think they're some of the key lessons that we've learnt across numerous schemes that we've delivered.
Andy, if there was one key takeaway that you want to give to our listeners off the back of this project, what would it be?
So we've got Dr. Richard Sanford-Hill, the Devizes Integrated Care Centres, having a really key leader with a really strong driving force behind the project. Not just at the very start in setting the vision, in having a facility that would integrate care on the site, but actually him being present throughout the project, taking really strong interest, challenging us around programmes, deadlines, all those kind of issues, challenging us around funding availability. And I think he also engaged very, very closely with the local MP as well. So there's a whole that whole kind of leadership and leading all the different stakeholders through the process from the NHS service provider perspective was really, really crucial. And I've no doubt that without him, we might still be talking about what we actually wanted in Devizes.
And Cheryl, for you, what would your key takeaway be?
So for me, I think it really is a great example of true partnership and collaboration. I think even being involved right from the outset to share the vision with us, and then setting that collaborative behaviour all the way through. Everything was shared, everything was open and transparent, and you had that trust, which I think was really important from everybody working on that project, from all of the stakeholders, from Andy's team, from the cost advisors and our design team and our construction team and our supply chain. Everybody was all bought in. It really was a project delivered by the collective, and I think having everybody bought into that meant that we were able to deliver on time, on budget. We didn't have to go back and do any value engineering, and we've essentially delivered a building that's great in operation for staff and patients, and into the future that can really take lessons forward.
And I think that's really crucial, isn't it, to recognise the team. There are too many people to mention who were involved in the development of this project. Cheryl and I are on the screen here, but actually there was, a whole load of people behind the scenes. And whilst Richard helped drive it forward, the contributions of all those different individuals who know who they are was really crucial in making this project happen and taking it forward operationally in the future as well.
So we're really pleased to be joined now by Dr. Richard Sanford-Hill. And Richard, you are the GP partner of Market Lavington Surgery, and we were chatting to Andy Strange, and he said that you were absolutely a key leader and a driving force behind this project. So, high praise. Welcome, thank you for joining us.
No problem at all. It's very kind of Andrew to say so.
So just before we sort of get into the details of the project and so on and the impact, can you describe what your role was?
Yeah, well, I think I probably instigated it. So it all started actually on a BBC Radio Wiltshire interview about 7 or 8 years ago, when Claire Perry, our local MP, asked why there wasn't a minor injuries unit in Devizes. And at the time I was working at the CCG and later went on to be chair of the CCG, and said, well, look, actually we can't justify a standalone unit in Devizes. And that's true. However, I recognise that there possibly was a need for a minor injuries service. which would be able to look after some of the minor injuries of the patients locally. And we actually had a nurse at the time working at the practice who'd worked in one of the minor injury services locally and now was working for us doing minor illnesses. So I thought, well, hang on a moment, if we want to start developing this, can't we do both together? And if you then start talking as one practice, we're too small. We don't have enough minor injuries. We don't really have enough minor illnesses to have a full-time nurse working out of the practice. But if you then looked around the 4 practices in Devizes, you've then got scale. And I then tried and succeeded, obviously, in persuading the other practices that actually the model of work doing urgent on-the-day care we could do as a bigger unit. The 3 practices in Devizes were the second worst in Wiltshire for space, i.e. GP space. So came up with the idea of actually a new build and putting all just the urgent care there. Now, most patients want to see their doctor for long-term conditions, that continuity of care. If you've got a sore throat or a chest infection, to be honest, most patients don't mind who they see. They want a healthcare professional that will see them in a timely manner. They don't necessarily need to see their own doctor. So with that in mind, we started looking at saying, right, actually, you know what, we can do this. We can also then start looking at other healthcare professionals. So if it doesn't need to be your own doctor, does it need to be a doctor? We then started looking at nurse practitioners. We've got a first point of contact physiotherapist. We've got some PAs, physicians associates, and we've actually got some registrars. So it's massively changed the way we work. The other problem we had in Devizes is there's a community hospital that has been there for 150 years, made up number, but that sort of time, that was just falling down, and that used to have wards, maternity units, a minor injuries unit, but over time these had been closed down, mothballed, and actually it was in a state of disrepair, to be honest, and with no plan for what the end game was for it. There was some physio done there, some audiology, some outpatients, but really it was just dying on its feet. So then thought, well, actually, hang on a moment. Why don't we lift and shift all the services that are currently being provided in that community hospital and move them over to the new build? So you then got better integration between the secondary care services that are provided there, the community care services that are provided there, and primary care GP, urgent on the day services.
Yeah. So I mean, you had the vision, and obviously based on your experience and your knowledge of the community and what the community needed to come up with the idea. I believe that the centre's been open since January, so very early days. But have you got a sense of the impact on patients and staff already of working in this way?
Oh yeah, 100%. So if we look at the 2 groups of people, the physiotherapists that are over there were working in a run-down building that was dark, whereas the new centre is, they've got their own rooms, it's well lit, it's their rooms are good size, they're purpose-built, they're good sizes. So they are, I think, very happy. More importantly, the patients that we're seeing, we're offering a good, timely service. They get an excellent service without a doubt, and we've got lots of surveys done of patients that are all extremely positive. Of course, like all things, we've had 1 or 2 people say, well, why couldn't we move into the old site and not that? But the trouble is in life, if you try and please everyone, you please nobody.
It is very difficult to please everybody with anything, but generally in the community, how does the community feel about this? Is it well thought of? Is it well regarded? Do you feel people are behind it?
Oh yeah, absolutely. I mean, one of the local councillors said to me, we've been waiting 40 years for this. So look, as I've said to other people, this building is not the end; it's the beginning. It can offer so many services. It's a good size unit. We've kept a bit of land at the back, so we could expand if needed. Because we're central in the middle of Wiltshire, which is quite a rural community, we can attract other people in. So if we, for example, were to say, right, let's do MRIs there, and get a mobile MRI scanner. For lots of people who live in the villages, coming to Devizes is a lot more convenient than going to Bath, Swindon or Salisbury. So, location is everything. There's lots of space there. There's lots of parking there. There is public transport there. So I think we've got a winner, really. And I'd be interested to see how over the next 10, 20 years this site and this facility can be developed.
We like to talk about this project as being a great example of early contractor engagement and what can be achieved when you get a contractor involved at the very start of the project, rather than sort of part way through when the design's already been done, or you're quite a ways through when it's difficult to change things. So we've spoken to Andy about this and the benefits from his point of view, but obviously he's somebody who works in the construction industry. Just interested to understand your perception of it as somebody who's that end user client, if you like, rather than that construction client.
Look, you want the builders involved because they know what the pitfalls will be and can advise you early on. This project's taken several years to get to where it is. Kier, I've had no problems with. What I mean by that is when it was right, it's in place, they said we'll deliver it by X, and they did. And then there was no, oh, we're running a bit late, or we're delaying you 6 months. They were true to their word, and the project was delivered on time. And I think if you walk around the building, it's as described on the tin, really. If you looked at what the architect had designed, which we've been part of, you can say, yep, that's what we asked for, that's what we talked through, it's there. So, I think Kier have been a good partner to have on board.
You must be super proud of it. It sounds absolutely fantastic in terms of the impact on the community and what you've sort of driven and developed.
Yeah, no, I agree. I mean, it's been a few years in the making, but it's a great site. It has, as I said, this is not the end. It has great potential going forward. I'm delighted with it.
Thank you to all our guests for their time and sharing their expertise. We'll be back next month with a new episode. In the meantime, don't forget to hit the subscribe button on Spotify, Apple, or wherever you listen to your podcasts. You can also visit kier.co.uk/podcast to find out more. Thanks.